everyone, it's me, Carly Burridge, founder and owner of Gaining Health, and we're back for another episode of What's Up Wednesday, where we review a recent journal article from the Obesity Journal. So the article that we are reviewing today is from the March 2021 edition of the Obesity Journal, and the title of it is Vitamin D inhibits adipokine production and inflammatory signaling through the vitamin D receptors in human adipocytes. So the title there kind of tells you the outcome of the study already, but we'll go into a little bit more detail and talk about how we can apply this information clinically. So the objective here was to investigate the effects of vitamin D3 on adipokine expression. So those are the substances, the chemicals that get released by the adipose tissue, right? And also inflammation. So we know that adipocytes can release inflammatory cytokines, especially in somebody with obesity or that sick fat disease or adiposopathy. So they wanted to study the adipokine expression and inflammation and the effects that vitamin D has on that in human adipose tissue, and also look at the mechanisms involved in that. So why is this important? First of all, we know that a low vitamin D status is associated with obesity. It's associated with higher risks of insulin resistance and type 2 diabetes. And we know that 90% of our patients with obesity have low vitamin D. And so it turns out that vitamin D metabolizing enzymes are expressed in the adipocytes, which suggests that adipose tissue itself may play a role in increasing vitamin D metabolism, thus contributing to the vitamin D deficiency that we commonly see in this population. And so what they found is in this study was that the secretion of leptin and IL-6, in addition to other pro-inflammatory cytokines such as IL-1B, IL-8, and macrophage chemoattractant protein, which all increase inflammation, were suppressed by vitamin D. So vitamin D might be an important component of decreasing the inflammation that we typically see in obesity. And we know that adipocyte inflammation increases the risk of many of the obesity-related metabolic diseases that we see, such as type 2 diabetes, dyslipidemia, the list goes on and on. And in addition to that, through vitamin D's effect on hormones like leptin, vitamin D may also help regulate systemic energy metabolism. So it can also play an important role in that. So the take-home point of all of this is make sure that you're checking vitamin D levels on all of your patients with obesity or metabolic syndrome, and that we're supplementing with vitamin D if they are low. And I know that, and this is not part of the study, but I know that insurance coverage for these labs can sometimes be tricky. So the indications for vitamin D testing are at this point chronic kidney disease stage 3 or greater, hyper or hypocalcemia, so either one, hyperparathyroidism, hypoparathyroidism, osteomalacia, osteoporosis, osteopenia, rickets, vitamin D deficiency that has already been diagnosed to monitor the efficacy of replacement therapy or if somebody's on replacement therapy already. Any type of malabsorptive states, including any types of GI surgery and things like that. A history of cirrhosis. And I also like to sometimes use long-term use of medications. Sometimes that also helps with getting this lab test covered. So that's it for this week for What's Up Wednesday. If you haven't checked out gaininghealth.com yet, please make sure you do so. We have some great new products and resources that are available on the website, including the book, Developing Your Obesity Management Program, the Healthcare Provider's Roadmap, as well as templates and letters and forms that you can use for your obesity medicine practice. And I continue to develop more resources for you all, and I hope to be releasing patient education materials later this spring or maybe early this summer. So if you subscribe to gaininghealth.com, then you can stay up to date on all of the new resources that are released. So that's it for this week. I hope you all have a great rest of your week, and I'll see you back next Wednesday for What's Up Wednesday. Take care.